Good afternoon. Today we will discuss about diseases of the ureter, ureteric calculus. A stone in the ureter is always originates from the kidney. Ureteric colic is the main symptom of this condition. Hematuria, also known as blood in the urine, may be complained of. Ureteric colic starts as soon as the stone enters the pelvic-ureteric junction and recurs at longer or shorter intervals, so long as the stone remains in the ureter. Ureteric colic ceases when the stone is ejected into the bladder or stone is impacted in the ureter. When the stone is in the upper one third of the ureter, pain starts in the loin region or near the renal angle and gradually radiates to the groin. Pain is gripping in nature and starts suddenly. The patient almost tosses over the bed in agony, often associated with profuse sweating and nausea. Pain suddenly goes off almost as suddenly as it appeared. At the lower level, pain commences rather anteriorly just above the iliac crest and is referred along the two branches of the genitofemoral nerve to the testis in the male and labium majus in the female and to the anterior-medial aspect of the thigh in the both sexes. The testis becomes retracted by the spasm of cremaster muscles. When the stone enters the intramural part of the ureter, pain is referred to the tip of the penis and the patient complains of strangury or strangury is also known as tenesmus of the bladder, frequency of urine or increased frequency of urine. When the stone becomes impacted, colic goes off. Instead, a dull ache arises according to the site of impactation. Such pain varies in intensity, increased by exercise and relieved by rest. On the right side, this condition may be confused with appendicitis. On examination, tenderness and rigidity may be felt along the course of the ureter. No examination of a urinary case. A stone in the lower part of the ureter may be felt in the rectal or vaginal examination. Straight X-ray often relieves stone along the course of the ureter. Urography will relieve a non-opaque stone by filling defect. No excretion or delayed excretion is sometimes seen after an attack of ureteric colic. Cystoscopy will relieve a stone on the ureteric orifice. It will show delayed or no excretion after intravenous injection of indigo carmine. And next topic is vesical calculus. Stones may come to the bladder through the ureter and enlarge here. Otherwise, stone may form in the bladder secondary to stasis and infection. No age limit from this disease. Males are much more often affected than females. Increased frequency of micturition is the commonest symptom. This is not experienced at night. The cause is that in standing posture, the stone comes contact in with the trigone and initiates the desire to micturate. During night, the stone falls off the trigone and frequent desire to micturition goes off. Presence of stone in the bladder will give rise to pain in the suprapubic region, particularly after micturition. This pain is often referred to the tip of the penis or to the labia majora and becomes aggravated by running and jolting. Children may scream and pull the prepuce for pain after micturition. Hematuria at the end of the maturation is also a common symptom. This is caused by abrasion of the vascular trigone and gets worse on exercise. Sudden interpretation of the flow due to the blockage of the urethral meatus with the stone and subsequent continuation by change of the posture is also not uncommon. So symptoms of cystitis, frequency of the micturition and burning sensation, post-pubic pain, etc. Sometimes stone may be situated in the post-prostatic pouch or diverculum without any typical symptoms of the stone and is only revealed in X-ray or cystoscopy for other complaints. These are known as latent stones. On examination, one may elect suprapubic tenderness. A large stone can be felt per rectum or per vaginal examination, but bimanual palpation may facilitate palpation. Urine should be examined microscopically and bacteriologically. Straight X-ray will relieve about 90%, 95% of the vesical calculus. The whole KUB region, that is kidney, ureter and bladder region, should be exposed to exclude further stones in the ureter or kidney. Urography will show non-opaque stones by filling deficit and demonstrate the functioning condition of the kidney. Cystoscopy and bladder sound will detect presence of stone as well.